Did you send yours out? How are you? I haven't seen you forever. I will see you on LinkedIn. Good, girlfriend. You need anything? Yeah, I called you that way. Text me.
That's all right. Because you know what? Let's see. Is a
Yeah, hard stop. I went there. You ready to roll?
Yeah.
Okay. All right, everybody, we're going to go ahead and get started. I'm going to call the meeting to order in just a second. Just going to ask everybody to take their seats. Start, are we good? Well, good afternoon, everybody, and welcome to the Joint Intergovernmental Relations Committee meeting between the Mecklenburg County Board of Commissioners and our school board members with CMS. Want to say welcome to everyone. My name is Mark Jarrell. I chair the IGR committee for the Board of County Commissioners, and we are excited about today's agenda. Anytime we get a chance to meet and have an opportunity to talk through issues in a collaborative manner, we know that it'll be productive for the community. I want to take this time to introduce the members of the board committee, and we'll start with District 2.
Good morning to all of you with whom I have not spoken, and it's good to see you. My name is Vilma D. Leak, and I represent the most powerful district in the county, and that's District 2. So welcome, and thank you for affording us the opportunity. And lunch, thank you. Where's Ms. Tanner? Thank you. This is the first time, I believe, we've had lunch, so I think this should be an ongoing process.
Thank you, Commissioner. District 5.
Sorry, good morning or afternoon. I'm Laura Meyer, County Commissioner for District 5.
District 6.
Good afternoon, everyone. Susan Rodriguez McDowell, elected by the people of District 6.
And I will turn it over to our chair on the IRC for the school board member and Vice Chair Stephanie Snead.
Good morning, Stephanie Snead, elected by the residents of District 4. I serve as Vice Chair of the board and Chair of our Intergovernmental Committee. And I will turn it over to our committee members, starting on my left with District 1.
Good morning, everyone. My name is Melissa Easley, and I am the District 1 rep. So I represent North Charlotte, Huntersville, Cornelius, Davidson.
Well, I'll just go in order. Good. Yep.
Good afternoon. I'm Lisa Klein. I represent District 5, which goes from Matthews around through South Charlotte up to South Boulevard.
Good afternoon, everyone. I'm Summer Nunn, and I represent District 6 on the school board, which spans Still Creek, moving eastwards through Pineville, Ballantyne, and the Providence area.
We also have some other board members here as well. Board membership.
Yes, I'm Lenore Ship. I represent at large, and that's the entire county. I guess you can say from Davidson all the way to Matthews.
Good morning, I'm Thelma Byers Bailey. I represent District 2.
Yeah, Starla will do staff introductions for the county.
Thank you so much, Mr. Chairman. It's a pleasure to be here. I'll start. I'm Starla Tanner, Intergovernmental Relations, Intergovernmental Affairs Manager, and then we'll go with our executive leadership team, our speakers, and then we'll roll around to the back to the other colleagues that are here. So, Mr. Ross.
Good afternoon, Derek Ramos, Deputy County Manager and Chief of Staff.
Good afternoon, Anthony Trotman, Deputy County Manager.
Good afternoon, Raynard Washington, Public Health Director.
Good afternoon, I'm Charles Bradley, Division Director for Youth and Family Services.
Hello, Elise Hamilton Childress, Prevention and Intervention Services Division Director for Mecklenburg County Community Support Services.
Good afternoon, Kim Henderson, Director of Family and Adult Services.
Good afternoon, Division Director, Volunteer Division Director for Housing Innovation and Stabilization Services with Community Support.
Good afternoon, Ronnie Devine, the Deputy Director for Community Support.
Rebecca Herbert, Community Relations Manager for Public Information Department.
I'm Danny Deal, Public Information Director.
Carly Godfrey, Senior Assistant to the County Manager.
Good afternoon, Yvette Stratford, Clerk to the CMS Board of Education.
I'll turn to Charles Jeter to introduce himself and as well as staff.
My name is Charles Jr. I'm the Executive Director of Government Affairs, Policy and Board Services for the Charlotte-Mecklenburg Schools. Before I move on, I do want to give an incredible shout out and credit to Ms. Starla Tanner, who has done yeoman's work putting this together. And I can't tell you how much I appreciate the work she's done putting this together. I'd like to take credit for it, and I'm going to, but she did all the work. Let's see. Dr. Medlock?
Good afternoon. I'm Ingrid Medlock, and I am the Chief of Staff in the Charlotte-Mecklenburg Schools.
All right. Thank you. Well, we're well represented today. That should count as a presentation, actually, right? Today, we've got a couple of presentations on the agenda. Following the presentations, we're going to make sure that we cover a few discussion items with our Public Health Director that actually was raised by Chair Sneed. And so as we begin the presentations, I want everybody just to understand that 1:30, we do have a hard stop. So I'm going to ask everybody to be respectful. I know there'll be a lot of questions and comments, but let's make sure that we give everybody an opportunity to discuss. Our first presentation today is going to be an overview of services and programs by Elise Hamilton Childress, the Prevention and Intervention Director in our Community Support Services Department. So at this point, we'll turn it over to Elise.
All right, good afternoon again, and thank you for having me here to speak today. I am decked out in my purple because today is October 31st, the last day of October is Domestic Violence Awareness Month. That's an important part of what we do at CSS. So I want to talk to you today about the ways that CMS and CSS collaborate to impact intimate partner violence in our community. A quick overview of our Community Support Services Department. We have three primary service divisions: prevention and intervention, housing innovation and stabilization, and veteran services. Prevention and intervention is the area I'm focusing on today. That is the division I oversee, but I wanted you to be aware of the other divisions within our department. Within prevention and intervention, we focused on domestic violence, substance use, and violence prevention, specifically teen dating violence prevention. We have four primary areas where we really intersect with CMS, and that is what I'm going to raise awareness of today. Those four areas are our intimate partner violence children services, our Love Speaks Out healthy relationships and teen dating violence prevention program, the Do the Right Thing challenge, and our domestic violence fatality review team. Our intimate partner violence children's services consist of free individual or group therapy for children and youth ages 2 to 18 who are impacted by intimate partner violence. These could be children who have witnessed or observed intimate partner violence in their own lives. It could be teens who are experiencing early relationships and feel unsafe in those relationships. It could also be teens who are showing early signs of potentially becoming an abusive partner and need early intervention to put them on a different path. To give you an idea of the reach of our program currently, during fiscal year 2023, we provided services in 33 CMS schools to 53 children, 234 individual therapy sessions to these children, and 14 group sessions. We also provide services in our office setting, but I pulled out the CMS data specifically so you can see what our presence in the schools looks like. And you will notice that 234 individual therapy sessions for 53 youth indicates the level of need and the intensity of need that our clinicians see. So, you want me to get closer? Is that better? Okay, thank you. So if you look at 234 individual therapy sessions to 53 children, that shows you the intensity of need that our clinicians are seeing. We're not providing just one therapy session to children. We are providing multiple therapy sessions to children. Depending on the modality being used, it could be up to 25 sessions. Our clinicians are licensed and they use trauma-focused cognitive behavioral therapy, They use cognitive processing therapy. Some of them use EMDR, child-parent psychotherapy. So it depends what modality the clinician is trained in as to what they offer, but they provide specific individualized clinical services to these kids in order to best meet their needs. Our Love Speaks Out Healthy Relationships and Teen Dating Violence Prevention Program envisions a future without dating abuse and domestic violence. This program focuses on healthy, unhealthy, and abusive relationships and provides youth with the knowledge of what to look for to know if a relationship is healthy or if there are signs they should be concerned about. This program is research-based. It was originally developed by Dr. Shanti Kulkarni with the UNC Charlotte School of Social Work, and it has an underpinning of the CDC's Connecting the Dots research on forms of violence. It focuses on 8th and 9th grade health classes, and we have an official memorandum of understanding with CMS that we renew every year in order to provide this program. During the 2022 to 2023 school year, we provided Love Speaks Out in 19 CMS middle schools, 17 high schools. There were 223 presentations total and nearly 6,500 youth reached by this program. I know that SB 49 is a topic later in this agenda. I do want to mention a concern that due to the parental opt-in requirement, we will be reaching far fewer students with this program. I pulled a couple of data slides just to show you how we evaluate Love Speaks Out. Our program staff are very dedicated to measuring their impact on an ongoing basis. Last year, they did a survey of teachers and community partners to see how they felt about Love Speaks Out programming. And the results showed a high rate of satisfaction with the content, belief that the program was effective, and that they would recommend it to others. There are several indicators that we ask the program participants to respond to before and after the session. During quarters 2 and 3 last school year, 82% of participants rated their knowledge of dating abuse and types of abuse as having increased or strongly increased after the session. 88% rated their knowledge of community resources for teen dating violence as having increased or strongly increased after the session. The third program I want to talk to you about is Do the Right Thing. Community Support Services coordinates this as a part of the national campaign to end violence, which is based in Washington, D.C. This challenge engages middle schoolers in voicing their experiences and what they see as solutions to youth violence. Every year, we invite students across the community to participate by submitting their written perspectives on violence in their communities. They can write an essay, it could be a poem, it could even be a screenplay. Every year, we select 2 local students to represent Mecklenburg County as national ambassadors in Washington, D.C. During the past couple of years, we started collecting data on the types of violence that we were seeing in essays. So I pulled a snippet out for you to look at. You can see that bullying and cyberbullying was the most commonly form of violence that students were mentioning in essays. You can also see a significant number mentioning gun violence, family violence, physical assault, community violence, violence in the media, suicide, self-harm, and then several other forms of violence as well. So this tells us that middle schoolers in our community are impacted by violence in multiple ways every day, and this program gives them an opportunity to raise their voice on that. These were our national ambassadors this past summer. This is Michael Toddy of Colwood STEM Academy and Aaliyah Williams Camp of Eastway Middle School. I would also like to mention that both of these students were in the Communities and Schools program, and their Communities and Schools teachers supported them through this challenge. And you can see a few pictures there of Aaliyah and Michael during National Recognition Week in DC. I went with them and I can tell you it truly was a life-changing experience for them.
Last year, we had 30 CMS schools with students who submitted essays, and we had just over 1,000 submissions. The final program I want to mention is our domestic violence fatality review team, really more of an initiative than a program. Our team was established in 2009 as the first one in North Carolina. It is established by state statute. The team conducts quarterly intensive confidential reviews of intimate partner violence-related homicides. The team has multidisciplinary membership, and we do have CMS representation on the team. Our current CMS representative is Anna Priester, who coordinates the crisis response for CMS. And the team forms recommendations to prevent intimate partner violence homicides. In nearly every review, there are recommendations that are relevant to the CMS sphere of influence. We almost always have recommendations related to early childhood prevention and intervention, cross systems data sharing, and the intersections of substance use and mental health. In about half of the cases we review, we do find that children were in the home at the time of the homicide. And I pulled out the age data for those children for you to see. So in 46 cases that the team reviewed between 2010 and 2022, we saw that 62% of the kids who were in the home when the homicide occurred were between 0 to 5 years old, which we know is that crucial opportunity for early childhood prevention and intervention. I want to thank you for the partnerships that CMS engages in with CSS. I look forward to continuing these partnerships and to seek other opportunities for growing our collaborations. I believe that we truly make an impact in our communities every day with the work we do, and it is a pleasure to have your buy-in and support. So thank you.
Thank you, Elise. I'll turn it over to Chair Sneed for our CMS colleagues to ask questions.
Thank you so much. I will turn to my colleagues. I have a couple of questions, but I'll turn to my colleagues on the committee first for any questions that they may have, followed by other board members, non-sitting committee board members.
Hi. So you mentioned that with new regulation that you're going to be meeting a lot less students. Is there a plan to make up for that so that we can reach as many students as possible? Are we going to be calling parents? Are we going to be like, what is there a plan or thought on how to make sure that we can reach as many students as possible and going out of our way to do that?
Yeah, that's a great question. I have talked with our program staff about how we can pivot, how we can try to get to more parents in order to educate them about what we do and what types of education their child could receive if they opt in. So we are trying to figure out where we can reach more parents, whether that's possibly PTA meetings, through community organizations. So it is a difficult audience for us to reach. I would welcome any partnership in reaching that audience, but yes, we have talked about needing to focus on parents.
Okay, just a follow-up to that. Is there a form they need to fill out, or how does that, is that form on the website, or where is that form? That they have to
We
fill out?
do have a form on our website for requesting Love Speaks Out presentations.
Okay, but how, like, if I reach out to a parent and say, hey, we've got this program, you need to opt in, is that a school level or is that a district level? Like where do they go? Where do I direct them?
So I'm going to turn to Dr. Medlock, just to set a little context for those in the room and those that may be viewing, is that, you know, there was extraordinary efforts in order to make sure that parents were aware that the opt-in process had to take place because of Senate Bill 49. There were communications that were sent out by email, text messages. School personnel were calling parents that had not filled out the opt-in form. So, you know, we went through all those efforts. We will continue to, I'll let Dr. Medlock speak. I said that, but I'm talking. I'll let Dr. Medlock speak about further efforts that we may be able to have the opportunity to partner with you all, and as well as any further engagement that we can have along in the school year.
Thank you. Vice Chair Sneed. I will say that with the opt-in process, you have to make sure that you are contacting the schools individually. Each school has put forth great effort to make sure all of the parents complete what we're calling a student information form. And on that information form, they're able to say whether or not they're going to opt in. They are able to say whether or not they're going to opt in for various programs within our schools. So if you would, and I actually had a question regarding the schools, if we could get the list of schools in my office, I would appreciate it. Exactly which schools are you all partnered with? And then we can go from there to make sure that the parents are aware. The Parents' Bill of Rights is very specific about what children can participate in and cannot participate in based on the parent's choice. So if you could send me that list of schools, and then we'll look at the percentage rates of completion for the student information forms, and then we can go from there.
Thank you. I have that information and can make sure you get it today.
Did you have a question, Dr. Medlock? She answered it. Oh, she answered it. She got it. And any other committee members? Board Member Nine?
I have a few. So on the Do the Right Thing, and I guess we can turn it forward, but we only had 30 schools participate. What was our target as far as participation there? Because it seems like it was middle school and high school, which means not necessarily the majority of the percentage participated.
Right. So Do the Right Thing is middle school specific.
Okay.
We would love if every school participated. I will say that we have definitely been recovering that program since the pandemic, and the participation rates have gone back up. They still haven't gotten to where we were pre-COVID. However, we are seeing it tick up, but we do invite every school to participate. Our program staff try to engage with principals, school resource officers to get the word out. They also try to help teachers understand how they might link it to writing standards because there is a written component involved, and a lot of the other national programs include it as writing assignments in their curricula. But we would love to see more participation. I think we're still rebuilding.
Got it. I guess maybe this is can I ask a follow-up? Sorry.
Yes.
Maybe it's more of a Dr. Medlock question. Is that something that we could do, actually make it a writing assignment, or is that up to each individual schools or even a classroom decision?
Actually, I was going to ask if, are you going through the school counseling departments at all?
I would have to check with our program staff to confirm that. I believe they do reach out to them because I know we do link students to the counseling programs if there's something in the essays, that suggests they may need to speak with a counselor.
So I guess my question is, at the start or initiation of the program, or when you're trying to get student participation, is that communication only going to school administration? That's appropriate, but are you also tying in the guidance department, the school counseling department?
At the initiation point, I don't think we are.
That would help.
Okay.
With participation. And then in regard to your question about a writing assignment, that would be a school-based decision. It would have to align with our curriculum. But obviously the teachers could agree through the guidance department and administration to tie it in, if that's something that the parents agree that their child can participate in through the opt-in process. But I think that will help you with participation if you go through the guidance department as well.
Thank you very much.
Board Member Klein?
Just some clarification with the CSS and CMS collaboration for children's services. You've got 33 CMS schools. Are these primarily Title I schools, or are they across the district?
I would want to request specific data on that to make sure I'm answering accurately.
I would like to get that info.
Okay.
So I have a question, it's in that same, the CMS, CSS collaboration with the students that have been exposed to violence. I can see the number of schools that you're in, the number of sessions that are held, but do you have any data on the percentage of those students that we know that have, that you know that have experienced violence that you're reaching? Like, so are you reaching 75% of those, 100%? Like, I'm just wanting a little more data surrounding this.
I don't have solid data on that. I can tell you with certainty, we are not reaching most. There are far more youth in our community and children who are exposed to violence compared with the ones we reach.
So then how do you identify, how do you come in contact with the students that you do reach?
A lot of our referrals come through Youth and Family Services. If there's been a report and there's an indicator of intimate partner violence, then they are often referred into our Children's Services Program for support. Some of our referrals come through the 26th Judicial Court, and some come from the schools directly. So a student possibly discloses to a teacher or counselor at the school, and then they reach out to refer them to services.
So help me understand the connection. So there's no direct connection with these group sessions or individual therapy sessions through the school?
The services are provided at the school in order to reduce barriers to services for the child. It's to provide them with an easier way to access rather than having to travel to our office location for services.
Okay.
It's a partnership. We do have a memorandum of understanding with CMS to provide those services.
Okay, so I'm just wondering if there's an opportunity, you know, that there's a gap here, right? It seems like there's a gap between that we may have the ability to reach more students. And I'm saying this is important because we are short school counselors, right? So we're short school counselors. So if you have an opportunity to provide counseling services to students, and I'm gonna charge Dr. Matlock with this to take this back to staff, is how can we bridge that gap with the families that you know are in, that possibly could benefit from these services, and then our students? Like, we have to figure out a way to kind of bridge that gap on notification to the families that this is available to them. And I would like the data on the percentage of students that you are reaching through this way.
So we're gonna go with Commissioner Leak, then Commissioner Meyer, and then Commissioner Rodriguez McDowell.
Thank you. Let me first say thank you for your presentation. My concern is this community is infested with violence. And you listed number of schools, but you didn't say what district or what the names of the schools are. Where are your greatest number? And I think that's what she was making reference to a few minutes ago. If we could find out where the problems are, then we can find out what kind of wraparound services is offered for those families, and to have direct contact with communicating back with the school system to let them know if there happens to be major issues in a given geographical area, so that we can target the area. Every morning you pick up the paper or look at the television, you see someone has been killed in this community, and just a 19-year-old this weekend. And I'm not saying that we can correct all of this, but we need to get a handle on the school system. So whatever we can do as a county offering services to those families, and that's the responsibility of the county, is wraparound services and communication. So please give us the number of schools, the names of the schools, the zip codes where these schools are listed, and what kind of services are we directing to those families. I was listening to the policeman talk Saturday night, children out at 4 and 5 o'clock in the morning in the street. Parents have to be held accountable for their children. So what is our role in that process? And the last thing I want to say, if a student misses X number of days in the Charlotte-Mecklenburg school system, The state law says that you have to call somebody and let the parents know that these children are out of school. And I'm not hearing that that's happening now. Communication with the family on Friday night. They had to take their daughter out of Ransom Middle School. And I've heard from Ransom 5 times this year already about major fights in that building. So we know where some of the problems are, especially those of us in districts that are communicating with parents and in the community. So I need to talk with the school system about the issue at Ransom this past weekend, because a family took their daughter, a 9th grader, out of school, and that should not be. Thank you so much.
Thank you, Commissioner. Commissioner Meyer, then Commissioner Rodriguez McDowell.
Thank you so much. Thank you for the presentation. I learned something new I did not know about Do the Right Thing, and I love that. There's so much value in writing and therapy and writing, and I really love that we're doing that. My question is, just to clarify, the group sessions are on campus. So, I mean, are you not going through the guidance office of each school? It seems like you would.
There's a connection there, but there's also a separation. We're coming in as a guest providing the services for children who are enrolled in the program after referral and intake.
Mm-hmm. Okay. And so before SB 49, a child could go to a teacher or a guidance counselor or an adult in the school, tell them they need help, and they might direct them to our services. Now with SB 49, what's the difference? Just for clarification, what will it be like for a child?
Right. So we are definitely figuring all that out. With our children's clinical services, those were already consent-based to begin with. Like, a parent has to consent for those services. So I'm not aware that there will be an impact on those services. The impact will be on our education and prevention, where before the parent did not have to specifically opt the child in to receive that, and now they do.
What are some of the services under education and prevention?
Like Love Speaks Out, potentially Do the Right Thing.
Okay.
Where a parent would have to consent to say, yes, I want my child to receive this education on healthy relationships, teen dating violence prevention. And then with Do the Right Thing, it could be, I want my child to participate in this experience on youth violence.
Okay, thank you.
Yeah.
Okay, so I just wanted to, I think I'm thinking the similar track as Vice Chair Sneed here, or Chair Sneed, sorry. The number seems really low, the 53 children getting services. It seems super low compared to the need. And my question for you is that because we lack the resources to provide services to more children? Or is there another barrier that's stopping us from reaching more children?
That's a great question. It's a little complicated. So that number does not include the full scope of our children's services programming. I just pulled out the services we provide in CMS. We also provide children's services at VCW, at the Valerie C. Woodard Center in the office. And occasionally we'll offer telehealth option for youth. That typically, won't be an option for younger kids. It just depends on what's going to make sense for them. But those numbers don't capture all of the children's services we provide. Our children's services team consists of a clinical supervisor and 4 licensed mental health clinicians. So it is a relatively small team. I will acknowledge that we have had some turnover over the last few years. We have all of those positions filled right now. That being said, it has been the process of recruiting new staff, training them, and then having them begin their caseload. So that impacts the number, and also just their capacity. So the maximum caseload for a clinician would be about 30. And the number of sessions they're going to be providing for each of those 30 will vary. So some youth may only receive, I don't know, 8 to 10 sessions. Some may receive up to 25 or even more. It depends. I have had staff tell me that over the last few years, they have observed that the intensity of the needs being presented to them have heightened, and they are in general observing the need for more sessions than before, which means we keep the same kids and services for longer, don't roll a new child into that spot because it wouldn't make sense and not to complete services with a child to the point where they can be ethically and safely transitioned out of the service. So those are a few of the factors that impact it. I can certainly get you more holistic data on the total number of children's services we provide and what percent are in CMS schools versus children coming to the office for services. But it is a little bit complicated.
Okay, thank you. A 30 caseload seems really high.
That's a lot for our clinicians and their own mental health as well.
Mhm.
So
I
that's as
would
high as we
really
would go.
like to know those numbers as far as how many teams there are and how many, kids they service and, what capacity, issues we're having. And if we needed to increase our resources there, I think that's something we should know, that we're making a choice not to increase those resources, or what exactly is holding us back. And just when you look at the common recommendations from the domestic violence fatality team talking about prevention and cross-system data sharing, are those roadblocks something that we can address, or well, especially with the cross systems data sharing, because I think prevention, that's a whole other, that's huge, but the cross systems data sharing, is that something that we can solve, or is that a legislative issue, or?
Probably some of both. So specifically with respect to early prevention intervention and cross systems data sharing, what our fatality review team observes time and time again is we know all of these kids out there who have witnessed an intimate partner violence fatality, and we wish we could follow them and make sure they are receiving appropriate supports. There are restrictions on, confidentiality and sharing information between systems that make that challenging, and decisions about whose responsibility should it be, would it be to follow those children? What does that process look like? We have looked nationally to see if there's another community that has that kind of approach in place. We haven't found one exactly. There has been some national conversation in the last couple of years about that issue, but we have not observed an effective process for following. That's something that we as a team believe would be enormously impactful in the trajectories of the lives of the impacted children who witness those homicides. But right now, it's hard to figure out how to get to them in a way that is ethical and legal. So maybe some things we can do locally, maybe some things that are at a higher level.
Thank you.
You're welcome.
Commissioner, it's a lot to unpack when it comes to mental health clinicians, both within CMS and the county. We're lucky back in 2021, you all approved 6 additional mental health licensed clinicians for this purpose. But it is very difficult to recruit because many of them are going in private practice and they're making a lot more money in private practice, and some just got out of the business as a result of COVID. So similar to some of the other issues that we talk about, like nursing and other professions, it is a difficult time nationwide. So I just, as we talk about the budget, there is budget to add additional capacity that you all approved.
Thank you.
So thank you for that. Elise, let me just say this Very quickly, one, thank you for the presentation. I think this is fantastic information for both boards to consider as we move forward. I think one of the key takeaways is there's plenty of opportunity, right? So I think with all of the takeaway questions that were teed up, we've got to make sure that we go back, drill down, figure out what the solutions are for us to scale, because I think the common theme is opportunity. I think we all feel that. We are the ones that have the collective, for lack of a better word, power to be able to deliver and provide staff the resources so that we can get the outcomes that we all desire for our families and our students. So fantastic information. Thank you so much. Final comment from me would be with respect to the do the right thing. Man, I wish I knew about these young people that are representing us on a national basis. And the other thing that I would ask our staff to do, I want to recognize them. They got to come, we at least should be inviting them to come to the board meeting and for us to recognize. We always talk about when these kids aren't doing things, I mean, parents aren't doing the right thing, but we really have families and children that are doing great things in the community. And you talk about ways that we should be celebrating. This is something that, again, from a collaborative perspective, we could celebrate and we should celebrate. We should highlight these things. So that was fantastic for me, and I so appreciate it. A couple things real quick, colleagues. We've got about 45 minutes left. We do want to welcome Commissioner Altman, who has joined us online. I want to remind everybody we've got a second presentation. Hi, Commissioner Altman. We have a second presentation, and then we also have a very robust open discussion that I know everybody wants to get to. So I'm just asking all of us to keep that in mind as we move forward. I know the non-committee members are here as well. Did you all have any pressing questions right now or comments, or can we save that to the open discussion? Can we save it to the open discussion, or? Thank you. I appreciate that. That'll allow us to try to cover a lot of ground. So everybody, the second presentation is going to be an overview of Child Protective Services from our Youth and Family Services Director, Charles Bradley. So I'll turn it over to Charles right now. He's coming. This minimum.
Good afternoon. My name is Charles Bradley. From Child, Family, and Adult Services Department, Youth and Family Services Division. It is my pleasure to be here this afternoon to provide an overview of Youth and Family Services with some highlights and around our work with Charlotte-Mecklenburg Schools. So for today's discussion, I'll talk a little bit about our YFS mission and values. I'll provide some intake data. Those are our child abuse neglect referrals. I'll provide some data on our family and home services, foster care, and then speak a little bit about our amazing young people that are served by Youth and Family Services. Just to give you some highlights on the scale and scope of our work in Youth and Family Services, we have 456 staff members. The majority of them are frontline staff, our child welfare specialists, over 200 social work staff, and about 100 managers and supervisors that provide these core services. Our intake area where we receive child abuse and neglect reports, our investigations where we go out in the field and in community to provide investigation services, and then our family.
Pause just a minute, once we get our technology.
Mhm. Yes. And then it needs to be presented mode. Thank you. I was talking about our core services, which are intake, investigations, family and home services, permanency planning, and our resource development. These are a few of our values and beliefs. I won't go over each one, but I will highlight just a few. At Youth and Family Services, we believe in family and child youth-driven practice, which means that we involve families at every step of the way. We value their voice and their contribution, their lived experience, to be able to craft the best plans possible to ensure the safety and well-being of the children. We believe that children and families have a right to be understood in the context of their own family, their culture, traditions, and history. So we want to make sure that we value those family connections, their history, their heritage. We also are committed to advancing racial equity, that we use a racial equity lens in all of the work that we do. We recognize in child welfare that children of color, particularly Black children, are overrepresented in our system. And we're really focused on improving outcomes for all children, youth, and families that we serve. This is the Youth and Family Services mission. We strive to strengthen families and communities to keep children safe. That really speaks to our understanding that all families come with strengths, that we build on those strengths in order to keep children safe. And that requires a full community, both professionals, our faith-based community, our business community, and our elected leadership that's represented in this room to be able to keep our children safe in our communities. This is a data slide that reflects the mandated reporters that make reports of child abuse and neglect. Here in North Carolina, all adults are mandated reporters, so you don't have to be a professional to make a report. If you see something, say something. We expect that you do call to ensure that children are safe and that we have the opportunity to intervene where appropriate. If you look over the last 6 years of data, you'll see that we receive over 118,000 reports. Of those reports, 63% are screened in. Just to give you a context, that number of 16 to 17,000 reports a year is more than several states in the United States. Just thinking about some of the areas and states that are less populated, some of our smaller states, we investigate more than a state system. If I can draw your attention to the screened in reports, those are that bottom line, the number of reports that we actually investigate. And just focusing on 2023 for a minute, we had 10,817 reports that we investigate. We do know that that represents probably, represents probably 30,000 children. We know that families are more than one. So we touch about 30,000 plus students or children in our system. We know that in our reportings, we see some patterns that speak to our need and our focus to always have a racial equity lens in our work, and that our disparities in reporting start at the front end. And that's why we have the door here. Looking at that first bar, we know that in Mecklenburg County, within the child population, those are residents under the age of 18. You can look at the distribution of race. So Black children represent 32% of the child population, white children at 34%, Hispanic children 22%, and multiracial children 12%. And if you notice going from left to right, we see that the representation of children of color continues to grow, particularly our Black children. So children involved in completing investigations grows from 32% to 56%. Moving over to the right again, those children that are substantiated, meaning that there's a finding of abuse and neglect, that climbs to 60%. And then over to that last column, we show the percentage of children of color or Black children grow to 63%. Looking at that data, that means that Black children in our community are 2 times more likely to be in foster care than their white counterparts. So really looking at what can we do as a system, as a community, to be more proactive, to minimize children coming to our attention, what prevention services and supports can we continue to develop so that children of color, and particularly Black children, are not in our foster care system. Wanted to give you a sense of who is making these reports, and it's important that we do have the opportunity to investigate. In my conversation, I don't want it to be assumed that we're saying don't make a report, but we want to understand where our reports are coming from. We're here talking with our CMS partners, and we see that 15% of the reports are coming from our education partners. And I draw your attention to the 33% that are coming from our law enforcement partners. That trend is very different than we see in, say, our counterparts in Wake County, where education systems is the larger reporter. However, in Mecklenburg County, it's our law enforcement that leads that charge. Right now, I can't give you definitive information as to why that is different, but that is different here in our community. I want to give you 2 examples that speak to the importance of having a racial equity lens and thinking about what more can we do to minimize children coming to our attention when it's not necessary. In the left box, I will tell you a little story about an elementary age child that was referred to neglect due to not having internet service. This was a young person, 3rd or 4th grade, who had some assignment that was due, and what the teachers and counselors found is that he wasn't able to do the assignments because he didn't have internet service. And the school counselor and teacher got together and they made a referral to our department. We sent a worker out there and found out it was a single father who was raising his child, and he didn't have the funds to be able to afford internet service. And what we found as we talked to more people at CMS is that CMS has partnerships with our local cable company that provided a hotspot. But instead of referring that family directly to that resource, they sought to contact our department. So this family has a CPS report. The department spent time investigating that case when a step could have been taken and brought in that father and asked some additional questions on what can we do differently to help your son be able to complete his assignments. So fast forward, as a result of the work that we continue to do with our partners in law enforcement and our partners at CMS in explaining the disparities that we see and asking them to ask additional questions. We're not asking you to investigate, but we're asking you to dig a little bit deeper to understand what might be happening with families. When you see a child that's not clothed properly or doesn't have internet service, can you call in the parent and ask, is there anything else that I can do? Is there an agency that I could refer you to that can help you with housing, clothing, food, or internet service? So I fast forward to our recent experience through our partnership with CMS. We identified 3,000 young people that had not logged on during the pandemic to receive remote education. And the first call was to say, hey, Youth and Family Services, we'd like to refer these 3,000 families or 3,000 children because they are not getting their education during the pandemic. Well, using our racial equity lens, we began to ask more questions. Well, how do you know that they're being abused and neglect? Could there be some circumstances that are preventing them from logging on? Do they have internet service? Are there family situations that could be preventing, you have 5 children, 1 computer? How can they all log on at the same time? And through our work, and I give credit to Dr. Penn, who partnered with us in the social work department to begin to ask those questions and to mobilize the CMS social work staff to go out in the field and knock on doors to find out where these children were. And what we found out is that what I just shared as possible explanations, by and large, were what was happening. Families had moved away. Some people didn't have internet service. Some families didn't know how to log on. So we were able to solve, and I think there was less than 5 reports of child abuse and neglect that came out of those 3,000. So just think about it, had we spent time and resources investigating 3,000 alleged educational neglect cases and what impact that would have had on children and families. So we are proud of the relationship and connection that we have with CMS to be thought partners and what can we do differently and better to support our community. And we avoided having 3,000 additional cases where they were not necessary. So this just speaks to some of the negative impacts of disproportionality. We know that child abuse does not discriminate. Underreporting of white children impacts their safety and well-being. We have countless cases that we see and investigate when children are older, they're 9, 10, and 11. And we talk with families and school personnel, and we learn of their lived experience, and they were never reported to our department. We have children in our hospital systems that come in with a accidental injury, a serious break on a non-ambulatory child, and that child is discharged to home only to come back with another break. And what we see is different is that those Black families that have that experience are referred to our department, and our white families are not, leaving them at risk for further harm. So what we're talking about is critically important, that we use that racial equity lens, but not in a way that does underserve our white children. We know that CPS involvement is traumatic, that it's traumatic to have the experience of child welfare being involved in your family, especially when it's something related to poverty and not having the means to be able to provide enough food or enough clothing. And we have a wonderful community that provides those things when people fall short. So how can we direct them to the food pantry or the clothing closet rather than referring them to child welfare? This gives you a snapshot of the families that are working with us that are intact. We have identified child abuse and neglect and a need for us to intervene, oftentimes around the issues of substance abuse by a parent, mental health issues of a child or a caretaker. And Elise teed us up very well to talk about the impact of domestic violence. Many cases involve those 3 issues, and in many cases are so complex they involve all 3: substance abuse, mental health, and domestic violence impacting a family and their children's well-being. So this calendar year, we've served 638 families. Currently, we have 360 families currently being served. This gives you a sense of how many children are in foster care, are waiting to reunify, or waiting their forever home. Currently, we have 458 children in custody. Those are children 0 to 17, and here on the chart, you'll see their distribution. I want to point your attention to the 18 to 20-year-olds in North Carolina. We're able to serve children or young adults. They always correct us, they're not children anymore, and they're not in our custody, but we do provide services for them to reach their greatest potential. So we serve them in our independent living programs, ensuring that they're able to pursue their educational goals, they have stable housing. We do all of those things to support them. Many people think about the needs of young children and supports, but anyone raising a teenager, I think we all know that they need just as much support and different support. So helping them transition to adulthood is critically important to us. This is just a quick slide giving you my information and the hotline number. that you can share with your constituents to making the report or contact me if needed. And now I just want to humbly brag on some of our young people. So this is a few pictures of our independent living program graduation. We were proud just in June, we had 14 young people graduating from high school. We had one graduating from a CNA program and one graduating from a dental assistant program. And we had one college graduate as well. On your left here, you see Judge Blake, who was wonderful for joining us and giving our group some inspiring words. We also had Judge Marvel present at our celebration. And this is a list of all of the wonderful schools of higher education that our young people are attending as freshmen this year. So some of you may see your alma maters up here and know that a child in foster care in Mecklenburg County is also a member of that class. And we are tremendously proud of them. We continue to support them through our independent living programs, and we can't wait for them to join that list of graduates 3 years from now. Last thing I wanted to share with you, this is our Adoption Day celebration, one of my favorite events that I do in my role as division director, where we have the opportunity to celebrate our young people gaining their forever family. So we look forward to being out at the courthouse. This is not a public event, but you as elected officials and partners, if you would like to attend, please feel free to email at the email address below, and you are welcome to join and celebrate families. We do a nice ceremony for our families. They come out with nieces, nephews, grandparents, and it's just a really, really wonderful event right before Thanksgiving. So that Saturday before Thanksgiving, if you are willing to come out and join us, hopefully we'll have nice weather. But it's an inside and outside event where we just get a chance to love on our families and really celebrate those adults that have taken it upon themselves to open their home and their heart for our young people. So that concludes my presentation. I welcome the opportunity for any questions that you may have.
Thank you so much. That was very insightful information that you've provided. I want to turn to committee members with any questions they may have. Board Member Klein.
Thank you. Looking at your mandatory reporters, you said 63% were screened. What about the other 37%? Were they just poor reports or?
Those reports did not meet the statutory definition of abuse neglect, so they weren't eligible for investigation. There are some where we feel that the family could benefit from services. So we do have community outreach where we can assign a worker to check in with the family. It isn't required or mandated, and offer services and supports for that family situation.
I have one follow-up. How many of these are repeat offenders or repeated reports?
I don't have that data present with me, but we do have a rate of a lot of previous involvement with families. I just don't have that data here with me.
Yes, thank you for the presentation. I'm going to follow up too on the mandatory reporters because I'm hanging on to your comment around Wake and why theirs is so much larger. But if you look, it looks like educational reporters are trending up, which isn't a good thing either, but good or bad depending on you know what we think the actual need is, right? But I guess my question is, with the educational reporters, what training is provided? And this may be more of a question for Dr. Medlock. And are there changes that have to occur with SB 49 as well too? Or is there any concern there?
I will share a little bit about our training, what we've done in the past, and I assume that we will continue to do, is that we do join CMS with their in-service training in the summer months. to train social work staff and teachers. We also offer in-service training upon request to schools, and we do a series to provide information on how to make reports as well. We also have school liaisons. We have 4 of them. 2 are funded by CMS and 2 are funded by the county, and they work collaboratively to increase awareness and communication between schools and youth and family services.
Thank you. Your presentation was very good. I do have a concern, and it is related to her question. When educational personnel make a report, at that point, that is an indicator that they've done whatever they possibly could to support that family. That means they've reached out, they've gone to the homes, they've engaged the guidance counselor, the social worker. The phone numbers may not work any longer. They are doing all that they possibly can. And out of concern for the child, they make a report. Now, I would rather them err on the side of making a report to you than doing nothing at all. And I think it is very important for us to understand during the pandemic, when everyone was virtual, our hands were tied. Several families moved and we were not notified whatsoever. So there is a time where you have to create a balance and understand that we're being responsible, we're showing concern, we're showing care. But you are correct, we must use our racial equity lens in doing so. My concern is I want it to be very clear that our educational personnel are extremely concerned about the care of our children. We want to make sure that their welfare is that they're in good hands at home and at school. And we want to make sure that they have all of the tools and resources necessary to be successful. I am not upset about them making these reports. I think it is something that we need to applaud them for because they are following the law. They're following policy and they're making sure that children get the best education possible. The training that they receive is an annual training. It happens at the school level, and yes, it happens at summer conference. But this is something statewide. All educators receive training on what to do if they believe a child is in danger or if they believe a child is being neglected. So I think we need to be very careful about saying that educators are making unnecessary reports. As an individual, if you feel like someone is in danger, I would rather you make the report than not.
Yes, thank you for those comments. And I do join you that if there's a concern of abuse and neglect, that report should be made. At the same time as there is a balance. We do see cases where those questions haven't been asked on every case. And those are the ones that we want to make sure that our partners are aware of the vast number of supportive services that are available that don't require child welfare involvement, like access to food pantries or support with housing or clothing, talking to a parent about transportation. That doesn't require child welfare services to be involved. And what we see is that more families of color receive those reports, where other families that have similar situations, those reports aren't made. They interface with families and parents in a different way to understand what is abuse and neglect. So it's something for us all to grapple with. By no means am I sharing that there isn't any right number of reports being made. We want to make sure that the right reports are made. So I'm not focused on the number. It's just understanding and asking questions where appropriate to determine if a abuse and neglect report should be made. Because as Mr. Trotman mentioned, we also have challenges with staff and workforce. So if we're spending time on cases that don't require our involvement, that's less time that we're spending with families that do require our involvement. It takes some 20 hours of staff time to process an investigation. So we need to be very judicious with our resources where possible. So we just encourage people to be thoughtful about those reports, inquire where possible, and really engage families. Because what we hear from families is that a teacher or counselor didn't talk with me about the internet service. A parent or teacher didn't talk to me about the availability of a clothing closet. I dropped my child off there every day and no one spoke to me. That's what we want to try to minimize, because teachers have to see them every day and they wonder why a principal didn't pull them to the side. Those are the conversations that we hear from families. So by all means, make those reports. We're available 24/7 to screen them, but we do ask for teachers to be thoughtful about it and ask the questions where appropriate. Thank you.
So in that same line of questioning, or discussion, do you have any data on surrounding when this was just a services issue?
I'm sorry. I didn't-
Like that that the issue wasn't necessarily a child abuse or neglect issue, that there is a services issue, meaning that they needed clothes, they needed internet, they need food, they need a food pantry. Do you have the data that surrounds the percentage of times that happens? And then particularly, so the overall data, and then as a subset, particularly when the reporters are teachers from CMS schools. Is that something you have or that you can obtain?
What I can share with you is that we know that the overwhelming majority of our reports are neglect. So some 80% of our cases are neglect. We only substantiate or have a finding of abuse neglect around 25%. So 75% of them, we are referring them to other agencies, other resources, or we didn't determine that the children were abused or neglected, which makes us think about, should a referral have been made in the first place? Because we're not finding or substantiating the amount of referrals that we're getting. It's about 25% we're finding that are true abuse and neglect. And imagine if we had a system that made sure that if it was a housing issue or food insecurity or a supervision, that we intervaced in a different way rather than child welfare. That's what we're trying to do. In other states, they're doing that. Instead of having a mandated reporter requirement, they're phrasing it as a mandated supporter requirement, meaning professionals have the mandate to ensure that families get those poverty-related concerns addressed without engaging child welfare, so that you're using your child welfare resources for the highest need families, not to help people get clothing or not to help them get food. Those are poverty-related issues, and reimagining a system where we structured ourselves in that way. So those are things that we strive to do. Those are innovations that we want to bring to Mecklenburg County that we don't have quite set up yet. But this is part of a journey of reimagining how child welfare interfaces with families to support them. Because we know the majority of them that are coming to our attention are related to neglect, not actual abuse or maltreatment.
So, I mean, I think that this getting to the gist of my question regarding the data surrounding that, because if there is, if in order for the school system to know that the types of reporting that are being made may be more of a poverty related, as you have phrased it, it would be beneficial to know that, I don't know, 50% of our teachers are reporting poverty-related matters to you. So then that is a signal to us to say, then we need to do a better job at training, right? We need to do a better job at applying the equity lens. But without that data, we don't know that there's an issues or these are one-offs. So we have to know if we're deficient in some way in that reporting in order to know how to modify our training, or if there needs to be more frequent training in this space. And I don't know if that's data that you can obtain or not.
Yes, I understand your question. That is a great question. That's not data that we are able to pull from our system. We can only see at the end that we know that 80% of our cases, 75 to 80% are not confirmed abuse and neglect, but we're not able to break it down to see what was reported to be able to say whether it was poverty related or something else. So unfortunately, we're not able to access that level of data that you're requesting.
Excuse
we
me,
are-
Madam Chair, Mr. Chair, just want to do a time check with both
Yeah.
of you on how you want to proceed with the rest of the agenda. Sorry to interrupt you, Charles.
You're
Needed to-
fine.
I thought you were almost taking a breath. I was-
Madam Chair, let me chime in real
We
quick because
have,
I know you
Dr.
you have another
Washington.
question. So what I want to do is I want to call an audible real quick, right? We had 3 other items on the agenda that I know everyone wanted to get to, SB 49 being one, Narcan being another one, and school violence being one. What I was going to ask is this, if the chair will agree to this, if we can get Dr. Washington to do one of his just very, very cover as much ground as you can. Wanted to be able to open it up to county commissioners and probably have to limit to 2.5 minutes apiece so that we can stay on time. But we would finish out that way, and then we would ask everyone else to submit your questions in writing so that we can tee that up, if that's agreeable, Madam Chair.
Yes.
Okay, and I also want to acknowledge the presence of Board Member De La Hara. Welcome, thank you for joining us. Dr. Washington.
Yeah, I was trying to decide if I should hobble or not. All right, I'll keep this as brief as possible as requested. I'll start with Narcan. I think that's the simplest of the 2 topics. Last year, we started a conversation with the district about putting Narcan in the schools, and we have been working over the last year to make that a reality. We originally or initially had hoped to have it ready to go by the beginning of the school year. Unfortunately, there were internal policies that need to be executed on the CMS side in order to make that a reality. And so we are still awaiting the final approval of those on the CMS side so that we can move forward. But we have purchased Narcan, and we do have a plan for having Narcan available in every school and the emergency health kits that we maintain in all the schools, we being public health. And we will be training the first responders in schools to ensure that there is someone other than the school nurse and others that know how to administer Narcan in case it's needed. The good news is we have not had any incidents to date, but I think everyone is aware of what's happening in the world. And so we do want to be as proactive as possible with making sure that it's available. It is currently available in some schools because if there is a CMPD school resource officer, then those individuals do carry it with them. The CMS school resource officers do not carry it with them. And so this will solve for us having it available in every school in the county. And so as soon as the policy passes the internal, I don't know the name of the work group, but maybe Dr. Mitlock will be able to reference the specifics here. As soon as that's done, we will be ready to roll out the availability of Narcan in all schools.
Madam Chair, if I could, Dr. Washington, so you are correct. The policy is finalized in its draft form. It'll go before the policy committee, chaired by the lovely and talented Ms. Shipp. My expectation is that it'll happen the week of November 13th for a variety of reasons. But that it'll pass that, and then roughly sometime, our first meeting after there is December 4th, and then we have one on December 12th. But I think that's the timetable you're looking at of getting this thing approved and modified by the CMS board is no later than December 12th. Everything's already been drafted. Now it's just a function of getting the meetings lined up and putting it in place. But we are weeks, not months from getting this done.
Thank you, Mr. Jeter.
That's it on Narcan. All right. All right, on SB 49, so we've been and we've been talking with, I think everybody has at least some basic background on what the Parents' Bill of Rights does. The one particular area of concern for us in public health, as well as our colleagues in the school district, of course, are the health screenings that are currently, that previously were not, were also opt out and not opt in. And these are things, for example, like the dental screenings for kids in elementary school, as well as vision screenings for kids, as well as a whole host of other kinds of non-clinical screenings, like even depression screenings, that would require now parental involvement to be able to approve. And so, of course, from a public health perspective, we see it as a real equity issue. And again, our colleagues in CMS feel the same way. We did have a meeting, I believe, a couple of weeks ago to get some updates from the CMS team as we work through the consent process. It does not impact the school nurses in their work because similar to the colleagues in CSS, that is already a consent-based process. And so what the nurses do is covered. It doesn't cover emergency health. So if a child is having choking or something, or having an overdose, those kinds of things will not be impacted. But it really is those preventive screenings, which are currently on pause until we have a consent process in place for them. And so until that is in the place, we cannot move forward with those. And so that is something that we're obviously trying to be as supportive as possible to, again, the colleagues in the district. However, we can help to make sure that we get that process instituted as quickly as possible so that those screenings can get back to going on for families and kids.
Madam Chair, if I could, I will offer that CMS specifically has reached out to the General Assembly to ask that the dental screenings and some of those things be clarified, that is not the intent of this legislation. We're hopeful that'll pass. They did in technical corrections, the General Assembly did pass as part of their technical corrections from 2 weeks ago, modify one health screen that is not subject to Senate Bill 49 that would have been previously. Off the top of my head, I don't remember exactly what that one is. I was looking at it, but I will email that to everyone here. But they did, as they wrote Senate Bill 49, they basically captured everything. There was one screening that rose to a level of outrage, for lack of a better word, by the community writ large, and they exempted that one out from Senate Bill 49. I'm sorry, I just don't remember what it was, but I'll email that to everyone here so y'all have that this afternoon.
I think it's behavioral health, but don't quote me on that.
I think you're right,
Yeah.
but
The school of government just came out with a blog last week speaking to the specific issue because it's a notion of what counts as treatment and what does not count as treatment. And so the screenings that are conducted by a healthcare professional are among all legal interpretations counted as treatment, even though it's not actually treatment, it's preventive. And so it is an advocacy issue, I think, that both elected bodies can take up as it relates to ensuring that these that any corrections can be made to make sure that kids don't receive the care, because of course we know the kids who will benefit most and also be hurt most by this are folks who are suffering from other issues in terms of poverty and their lived conditions. So it's important.
So Dr. Washington, I'm going to interrupt you. I want commissioners to be able to get some final thoughts in. We're just bumping up against time. Great conversation. I want to start with Commissioner Rodriguez-McDowell, go to Commissioner Leak, then Commissioner Meyer, please.
Thank you, Mr. Chairman. In the interest of time, I'm going to pass.
Commissioner Leak.
Thank you. Let me first say thank you so much for the presentation and the information. Many of us have been given information on these issues. And one of the major concerns I have, I think I asked, what law says that parents must have their children in school? If a child misses 10 days of school, what happens? Who's notified? And what happens once that's done? You don't have to tell me today.
Commissioner,
See if I get the information, because I keep hearing from parents, no calls. Kids out of school, and I'm worried about that. The other piece is the lacking of internet. We knew that there were many families who were not, did not have the access to internet. The community offered facilities within the community, and the system never returned any calls to those communities to say that they want to use the facility from the school system's perspective. Now, you know, you can hear everything you want to hear from different people in different sections of the community. So hopefully that in the future, if there are major problems that the community can help you with as a school system or with the county, let the community know so they can be a part of the process. And I keep getting complaints about the correction or either correcting children, the behavior in the classroom is terrible. But my thing is, parents have to be held accountable and not be afraid to write students up or whatever your procedure is to deal with behavior. Because school violence has gone up. It's not going down, it's going up. And the community itself and the nation is suffering from this very issue of violence in our country and abroad also. So we need to do a better job of correcting issues in the classroom and at school. One last statement and I'll be through. When I was a teacher, if class started at 7:30, you had to be there at 7 o'clock and be on duty at the door to direct young people to the classroom. You walk into schools today, kids all over the place, not walking to the right, no direction. And I look at the principal as the lead teacher in the building. So I just need to say that would cut down on some of the problems. We create more problems than what we can handle in terms of the community. And it starts basically in the community and they bring it to the school or to the bus station. So I'm hoping that we can do a better job as a community in working with our young people and do something about the violence every day. I just said a 19-year-old was shot yesterday. Every day there's somebody and they're getting younger. They're not getting older and they look like me and you. So how do we handle this problem as a school system and as a county? What do we do to correct this problem?
Thank you, Commissioner. Commissioner Meyer.
My questions are Mr. Bradley and I will email him.
Thank you. And I know we've got some non-committee members that have been sitting patiently, so we've got limited time. If you can, 30 seconds to a minute for a comment, please.
No, board member Ship had a question or a comment.
Yes, I want to thank you for all the information we've gotten today and the reports. Mine was specifically, I think it would go back to CMS partnerships and the program CSS prevention. I was really concerned, and I think this also goes with Dr. Medlock. How were you scheduling? Because I think this is really good. This is just wonderful and it's much needed. How were you scheduling with schools, students' time? Because I think it's very important that we are getting them in. We are doing therapy, but I didn't hear anything about how the connection between them coming to the schools and providing this service and how is the school dealing with this? Because I think one of the issues might be, and what I know as former administrator and here administrators, someone coordinating all of this. Because any of these programs have to be coordinated with schools. So that leads me to believe, do we have enough support to coordinate these programs so they can be effective and so we can reach more students and families? Where's that process?
Elise, can you email that
You can email.
response, please, so we can try to get to
Yes,
everybody and wrap
thank you
up?
for that comment and question.
Thank you.
Thank you.
Board member De La Hara, I didn't know if you had a question.
No,
or
thank you
comment.
very much. I'm good. I just wanted to
Board
hear.
board member Byers Bailey. Okay.
Commissioner Altman, do you have anything?
No, thank you. I appreciate the opportunity to listen.
Well, thank you. I do want to say thank you to Dr. Washington and Charles Bradley. I think your presentation really pointed out the disparities with respect to reporting. I think that was really clear. I am concerned if we're talking about we're reporting people because of an internet issue, but that's a whole nother statement. Want to thank everybody for today's meeting. We're going to give Chair Sneed the last word, but I did want to take the opportunity to thank both committees, thank our colleagues for your work and for your collaboration, your partnership. We really appreciate this, and this is something that definitely must continue. And thank you for your leadership, Chair Sneed. And I'll let you have the last word, please, and adjourn us.
So thank you to both entities for participating today. I think it is, we should continue these conversations because just in this short amount of time, we have discovered some opportunities where partnership can be increased. I challenge us the next time, because my lens is always that education is everyone's issue. And so that we need to make sure that we have the city intergovernmental at the table the next time as well. to make sure that we are truly doing an intergovernmental effort in addressing the issues of our community.
All right, with that being said, thank you again. We'll call the meeting adjourned at 1:31.